Coronavirus.
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 The coronavirus pandemic.
Carter Evans is in Kansas City, which is averaging more than 3,400 new cases every day, and hospitals are swamped with patients.
So I would say March of 2020, we started getting anecdotal evidence that something was going on. Patients were coming in sick. Patients were canceling appointments. So it was a really scary time. We were all trying to figure out what was going on.
In March of 2020, when COVID really came to West Central Missouri, we shut down our clinics and went completely to telehealth. And through our partnership with the Primary Care Association, our first priority was to keep our patients and our staff safe.
I think we all realized as soon as the public health crisis was declared with COVID-19 that we were going to have to go above and beyond, simply because we have individuals in the communities that we serve as community health centers who don't have access to health care. It didn't really seem like something that was impossible because we simply knew we had to do it.
My work cell phone never stopped ringing. It was when I was getting calls at night, getting emails, even on the weekends.
We started providing drive-through testing, drive-through vaccination sites, which is something that's not normally in a clinic setting. It's a little difficult at first, getting it off the ground and really getting people to understand, how it all works and how to make it work. But we managed.
And many were very cautious. They were nervous. They didn't want to go to a place where maybe sick people were. So we offered them the comfort and safety of being tested from their car, and then if they tested positive, provide them follow-up treatment and care.
They gave people assurance that there was a place to go, someone to listen to them, and an opportunity to either get tested or get vaccinated or get the health care they needed. And just knowing that that place was going to be open and available to meet their needs helped so many Missourians. Everybody was scared, and our community health centers helped mitigate that.
Part of what was so tremendously gratifying in addressing this crisis is seeing how everybody pulled together.
I would say number one takeaway is partnerships. It is vital that, especially during a pandemic, that you look at all of your resources. Resources, you really have to think outside the box. Resources as to local partners, state partners, federal partners. We're all in it together, so let's fight it together.
My most memorable time, there's actually a picture of our team, the very first mass testing we did at a factory. One of our team members asked if we could say a prayer first before everybody came in. So there's a picture of us all holding hands in prayer. So I look at that and I tear up.
I'm astonished by some of the work that I knew that was going on during COVID. The last data that I saw was over 100,000 tests administered by FQs and still counting. Somewhere around 97,000 vaccinations administered by FQs and still counting. It was COVID for all of us was an extremely fast-paced and stressful environment, and you all rose to the occasion as shining stars, and we're just so proud of the work that the FQs did, so grateful for the work that you continue to do.
And another thing that community health centers are wonderful about is they know their communities and they know those that they serve, and they're really good about bringing the services to people in the unique way that needs to be done for that population.
It was important for the success of all of our COVID mitigation efforts to have the Missouri Primary Care Association, the health departments, higher education all come forward and help us together put on a united front to help with testing and vaccines when they came out.
Healthcare is a constantly changing field. It's a constantly changing profession. You have to be willing to adapt to that and work well under pressure. COVID definitely taught us how to do both.
As far as keeping the calm demeanor and just had to keep going. There wasn't really an option. Everyone got sick. We all took our turns, and then we just did what we had to do because there wasn't anybody else to do it. So we just kept going, rolled with it. I don't know. It's just being a nurse. This is what we do.
It was just a really scary time, but it was also it was unprecedented. But it wasn't unprecedented the way our health centers responded. I mean, they kicked it in the high gear too. And I tell you, they did everything they could to meet the need at the local level. Our health centers were doing things that they typically don't do in public health, but no one else was doing it. So they had to step up like they always step up.
Yeah, the pandemic was such a challenge, and to say I'm proud of our federally qualified health centers and how they responded would be an understatement. The way folks stepped up, I tell people this all the time, they really were heroes.
So I just want to thank our providers who were on the front lines every day providing COVID testing, COVID vaccinations. You know, COVID was scary, especially in the early stages of COVID. But despite those fears, they stepped up. On behalf of the MPCA and our legislative leaders, we just thank you for everything you have done for Missourians.